My name is Ahmad Amirul. My part is introduction. In this presentation, our group explores 4 research articles that examines the major factors contributing to cancer risk. Cancer is a complex disease influenced by many interconnected elements, and this article highlights how lifestyle behaviors, environmental conditions, genetics, and alcohol consumption each play an important role. The first study focused on diet and lifestyle, explaining how unhealthy eating patterns, lack of exercise, poor sleep, and environmental exposure increase overall cancer risk. The second study examines ecobiosocial factors in Malaysia, showing how cultural belief, access to healthy food, and social environments influence colorectal cancer risk. The third article looks at genetic factors, especially BRCA1 and BRCA2 gene mutation, which significantly raise the risk of breast and ovarian cancer among Asian women. The final study analyzed changes in alcohol consumption and how increasing, reducing, or quitting alcohol use directly impact the likelihood of developing several types of cancer. Together, these 4 articles provide a broad and evidence-based understanding of how cancer develops and how different risk factors interact. By reviewing these studies, this slide will explain the theory, research methods, and important findings, while also highlighting why cancer prevention requires awareness, lifestyle changes, and early detection.
Hi, my name is Muhammad Rasydan. My part is check. Number 1, to identify and explain the factor that contribute to cancer risk based on the 4 selected research articles. This objective focus on understanding what causes cancer risk. For objective number 2, to summarize the main point and key finding of each article, including lifestyle, ecological, genetic, and alcohol-related factors. Here we are highlight the most important finding for all 4 articles. For objective number 3, to evaluate the strength and weakness of each article through a clear and simple critical process. This objective look at how good or limited each study is. Strength includes strong method or good data, and weakness including small, simple size. For objective number 4, to provide suggestion for improving the quality and clarity of this study review. After identifying weakness, we get idea on how the study can be improved. For the last one, to combine all information for the article to understand how different factors are connected and how they influence overall cancer risk. This objective brings together all the findings for the article.
Hi, my name is Nabihah Humairah binti Ramli, and my part is critique. So now I will explain the critique of the 4 articles in the clear comparisons. For the first article, it is strong because it takes a holistic view of cancer by combining lifestyle, diet, and environmental factors. It encourages preventive habit, which is good for the public health. However, the explanation is quite technical, involving scientific concepts that can be difficult for the general readers to understand. The article also gives limited attention to the social and the cultural influences, and it tends to focus too much on the lifestyle causes while underplaying genetic and environmental factors. There are also important gaps, such as not considering whether the people are actually have access to the healthy food, safe places to exercise, or the financial ability to follow the recommendations. Next, for the second article, the main strength is it used of the ecobiosocial framework, which help explain cancer risk through the biological, social, and environmental factor. The qualitative interview also provide rich insight into Malaysians' cultural, belief, and daily lifestyle habits. But the weaknesses include the very small sample of only 12 participants from one hospital, which limits how far we can generalize the findings. It also relies on the self-reported information, which may be influenced by memory mistake or socially desirable answer. The study also leaves gaps such as not fully explaining cultural misconceptions about food and assumptions that if people know more, they will automatically make healthier choices. Next, for the third article, the major strength is that the study is grounded in the strong genetic evidence. It focuses on the BRCA1 and BRCA2 mutations and provide clear age-specific cancer risk estimates. This can help guide screening programs. However, the weaknesses are that it fully focuses on the genetic without including lifestyle or environmental factor. There are also imbalance in the ethnic representations, and it does not compare finding with the another Asia regions. Bias exists because many participants may already be aware of their cancer risk or are actively seeking genetic testing. A key gap is the lack of discussions on how socio-economic factor might affect cancer detections in BRCA carrier. And for the last article has a major strength in its extremely large sample size over 4.5 million people, which allow the researcher to isolate the effect of alcohol consumption more accurately. However, the study does not explore why people change their drinking habits. It also relies on the self-reported data, which commonly leads to underreporting. Bias come from participants not accurately disclosing their drinking behavior, and the finding may not apply as well to the women due to the small number of female heavy drinkers in the sample. Another gap is the assumptions that all cancer diagnoses in medical record are perfectly accurate. Overall, while each study has clear strengths, they also have limitations, bias, and gaps that affect how the finding can be interpreted and applied.
My name is Alif Irfan. My part is suggestion for improvement. For the article 1 by Bahrami Tafrihi, 2023, first, the author need to use practical daily guidance, which is balanced meals, recommendations, routines, and also simple exercise. It is very important so that the reader can apply into their life. Second is the use of global perspective. It is because staying healthy is harder in developing countries such as Haiti, Bangladesh, and Nigeria, because people may not enough nutritious foods and safe place to exercise or good healthcare. The third one is the author need to use simple language by using simple and clear explanation. It will help the reader easy to understand the article. And the last one is use step-by-step tips. Adding step-by-step means giving clear details, instruction that show reader exactly how to follow the advice, and it will help make easy to follow steps. For the article 2 by Masdor et al. 2025, the author need to provide a deeper analysis for factors affecting colorectal cancer, such as environmental, social, and policy factors. It will help reader to know how food access, lifestyle condition, and government health policy play a role in shaping cancer risk. Second one is the author need to clarify the link between health literacy and actual behavior. Health literacy means people know what is healthy, but a real life problem like expensive health food, not having place to exercise, and not having enough time can avoid them doing this healthy habit. The third one is explore cultural misconceptions in greater details. It explains about how common they are and how strongly they influence daily lifestyle choice. This will help the reader see how this cultural misconception start, how common they are, and how they affect daily lifestyle choice. And the last one is the author need to use simple language. The article should be in the reader friendly. This will help the reader easy to understand about the article. Next is Article 3 by Ho et al. 2024. The author need to provide a different factors such as lifestyle, environmental, and socio-economic to help readers see that the cancer is shaping by multiple interacting factors, not just only genetics. Second is expanding the scope of the study. Means the author need to include more underrepresented ethnic group so that the results are more accurate and can be applied to everyone. The third is the author also need to use simple language. Just use a simple explanation for genetic terms and statistics so that the people who are not expert can understand them easily. And the last one is add visual aids. Just use picture, charts or simple boxes to show important results so everyone can understand even without scientific knowledge, because not every reader have a background in science. And the last one is Yo et al. 2022. The author need to make a long-term research. A long-term study with regular follow-ups can help understand the real and long-term effect of changes in alcohol consumption on health. Second is the author need to avoid bias in research. Conduct sex-specific analysis to identify differences between men and women to make more accurate research. And the last one is provide more context on why participants reduce or stop drinking. Example like health concerns, lifestyle change, and social or cultural factors. This will help you to see why people reduce or stop drinking and how all the factors affect their choice.
Overall, the 4 articles show that cancer risk does not come from a single cause, but from the combination of lifestyle, environment, genetics, and behavior. Unhealthy diets and daily habits increase cancer risk, while environmental and social factors influence people's ability to make healthy choices. Genetic factors such as BRCA1 and BRCA2 mutation also play a major role, especially for breast and ovarian cancer. In addition, changes in alcohol consumption directly affect cancer risk. These studies highlight that effective cancer prevention requires a holistic approach, improving lifestyle habits, understanding genetic risk, creating supportive environments, and reducing harmful behavior. By combining scientific evidence and practical awareness, individuals and communities can take more informed steps to reduce cancer risk and promote long-term health.